Today we're going to focus on the cardiorespiratory system. Cardio, of course, we know means heart, and respiro means lungs. And the two are so intimately linked together that oftentimes they will be in a chapter in a textbook titled the cardiorespiratory system. And because the heart is going to pump deoxygenated blood to the lungs to pick up oxygen and get rid of carbon dioxide, and then in turn oxygen is going to be gathered from the lungs, picked up by the bloodstream, and then returned to the heart, where the heart will circulate that oxygen-rich blood. There's such an intimate link between the two that it also just bears that they oftentimes are linked together when students are studying the material. Well, we know from looking at our skeleton that the thoracic cavity, composed of the rib cage, is going to contain the heart and the lungs. And when I remove this little model and look at this bigger model with the ribs removed, we can see that the lungs are going to fit right in this space and surround the heart. Okay. And here we have a model that shows the windpipe, the trachea, and how it is going to lead to the lungs. And we can see how the heart is absolutely surrounded by the lungs. Okay. Now, the lungs that surround the heart, we're going to have a right lung and the left lung. The right lung has three lobes of it, and the left lung has two. Now, to make sure that each structure is able to work independently, the lungs and the heart, each of these organs are surrounded by a membrane. The lungs are going to be surrounded by the pleural membrane. And again, a membrane is going to be, in this case, a serous membrane that has a lubricating gel, so to say, that allows the lungs to expand and contract and not stick to the heart and impede their ability to take in atmospheric air, extract the oxygen, and then ultimately collect the carbon dioxide and expel it during expiration. The heart is about the size of your fist. So when I put this glove on my hand, it's not that far-fetched of a model to say that this is like the pericardium. Okay, the pericardium has an outer part. Okay, this is called the parietal pericardium, and it's not in contact with the heart. But again, if my hand were the heart, okay, and we could say this is the heart, this inner part of the membrane is the visceral pericardium. Viscero means organ, so the visceral pericardium. Okay, so the outer part of the pericardium is the parietal, the inner, the visceral. And again, this is going to allow the heart, because of the close proximity that it shares with the lungs, to be able to contract and not stick to the lungs. Okay, again, the lungs are going to be surrounded by the pleural membrane. The outer part of that would be the parietal pleura. The part that's actually in contact with the lungs would be the visceral pleura. The heart, located right here inside of this little area created by the lungs, that it's going to be surrounded by the parietal pericardium, the outer membrane, and the inner part of the membrane, the visceral pericardium. Let's set this aside for just a second. Now, this is the heart itself. The heart is going to be a four-chambered structure. There we go. And these upper chambers are going to be the receiving chambers. They are the atria. Okay, the right atrium, single, is going to collect oxygen-poor blood from all parts of the body, and the left atrium is going to collect oxygen-rich blood that returns from the lungs. So this would be situated right in this region. Okay, you can see that it mates up perfectly right here with our model. And so this is the right atrium. It receives deoxygenated blood from all parts of the body, fed by the superior vena cava and then the inferior vena cava. They both have openings right into the right atrium. It receives deoxygenated blood full of carbon dioxide, and that carbon dioxide is going to be the main waste product of metabolism. Now, deoxygenated blood from the right atrium is going to go through this valve. Okay, it's called the tricuspid valve. It separates the atria from the ventricle. You'll also hear it called the right atrioventricular valve. From the right ventricle, deoxygenated blood will go through the pulmonary trunk and then the pulmonary arteries. The right pulmonary artery carries deoxygenated blood to the right lung. The left pulmonary artery carries deoxygenated blood to the left lung. And then ultimately, when that deoxygenated blood makes its way over to the lungs, it's going to get rid of that carbon dioxide when we exhale and then pick up oxygen from the atmospheric air that we breathe in, and the atmospheric air at the smallest structure associated with the lungs, the alveoli. The alveoli is where gas exchange will occur, and oxygen in those alveoli will then go into the bloodstream and ultimately oxygenate that blood. It will return to the left atrium of the heart through the pulmonary veins, and then there's going to be a left pulmonary vein and a right pulmonary vein, each coming from the left and right lung respectively. But those pulmonary veins have attachments inside of the left atria. It's going to go through a valve called the mitral valve. It may also be called the bicuspid valve because the valve has two flaps or cusps, or you may also hear it called the left atrioventricular valve, because it separates the atria from the ventricles. Once that blood gets into the left ventricle serves as the main pump of the heart. And that left ventricle is going to pump blood through the aorta, and then the aorta is going to branch so that large arteries forming off of the aorta get the oxygen-rich blood that they need to all of the organs and all of the cells of the body. Okay, here we can see branches off the aorta that are going to go to the brain. Those are the carotid arteries. And then the aorta is going to come down behind the heart. We call that the descending aorta. That's going to take oxygen-rich blood to the organs that are below the level of the heart. Okay, so once again, the heart is a four-chambered structure: right atrium, left atrium, right ventricle, left ventricle. The right side of the heart is going to collect deoxygenated blood from all parts of the body. This deoxygenated blood has carbon dioxide in it, and the carbon dioxide is going to be the main waste product of metabolism. Now, once the deoxygenated blood gets carried into the right atrium from all parts of the body through the superior and the inferior vena cava, there are openings inside the right atrium where this deoxygenated blood arrives in that structure. It goes through the right atrioventricular valve, also called the tricuspid valve because it has three cusps. It goes into the right ventricle. The right ventricle is the main pump of the right side of the heart. It's going to pump this deoxygenated blood to the lungs. It's going to go through the pulmonary trunk, and the pulmonary trunk is going to divide into two major arteries, the right and left pulmonary artery, that carries deoxygenated blood to the lungs. Right pulmonary artery carries deoxygenated blood to the right lung. Left pulmonary artery carries deoxygenated blood to the left lung. At the lungs is where gas exchange occurs. The tiny air sacs that make up the lungs, the alveoli, are going to take in carbon dioxide, and when we inhaled, the alveoli filled with oxygen. So as carbon dioxide is coming into the alveoli, oxygen is leaving the alveoli and going into the bloodstream. All of these capillaries combine to form the pulmonary veins, and the right and left pulmonary veins are going to join with the left atrium, and from the left atrium it's going to go through the mitral valve into the left ventricle. When the left ventricle contracts, it's going to pump blood out through the aorta. That is going to allow oxygen-rich blood under a lot of pressure to make its way quickly through all of the miles and miles of arteries and arterioles and arterial capillaries that make up our body. So that's an overview of the heart and the lungs. Now, getting into some more important aspects of the heart. Again, this is our heart. It's a four-chambered structure about the size of your fist. And again, it's going to have valves that separate the upper chambers, the atrium, in this case the right atrium from the right ventricle, and over here separate the left atrium from the left ventricle. It's also going to have this muscular septum, which separates the right side of the heart, which is going to take in deoxygenated blood from the left side of the heart. Okay, so ultimately, we have two pumps associated with the heart, the right ventricle and the left ventricle. Well, what makes these pumps work? We have to have electrical stimulation before mechanical stimulation occurs. And that's going to be the job of a structure in the right atrium called the SA node, the sinoatrial node. The SA node is going to emit electrical impulses, so the right atrium and left atrium contract in a timely manner after fully filling and push blood down into the right ventricle and left ventricle accordingly. The electrical pattern then includes what's called the AV node. The atrioventricular node, the AV node, the atrioventricular node is going to give a little bit of a delay before it signals for the ventricles to contract. Then that electrical impulse is going to go to the bundle of branches, and then through the right and left bundle branch to what are called the Purkinje fibers. The Purkinje fibers are going to make sure that all of the electrical activity fully stimulates these lower chambers because they're the main pumps of the heart. We want to make sure that they do their job in a timely manner and an efficient manner. Because again, our heart's only about the size of my fist. Okay, remember when I put the glove on and said this was representing the pericardium and this was my fist? Well, that is an accurate assessment of the size of the heart. this structure, even though it's only the size of my fist, pumps blood through more than 62,000 miles of vessels in our body. That's enough to go around the entire planet 2.5 times. So all of these vessels have to get this oxygen-rich blood to all of the cells, then in turn pick up the deoxygenated blood filled with carbon dioxide and get it back to the heart. So these lower chambers, the ventricles, have to be able to contract and in a timely and efficient manner so they can do the job. They can do the pumping to get oxygen-rich blood through the arterial system to all of the cells of the body, and then in turn collect the deoxygenated blood and get it returned to the right side of the heart, so ultimately we get rid of the waste product carbon dioxide and pick up oxygen. Now, the way the heart is able to use this conduction system is because there are two main types of cells in the heart. There are the contractile cells, and just as the name would imply, contractile cells contract. They are the muscle behind the myocardium. Myocardio literally means heart muscle. So when we're talking about the heart, it's mostly composed of muscle, myocardium. And we know that muscles contract, whether it be a skeletal muscle that attaches to our skeleton, like the bicep that can contract, or in this case, cardiac muscle that also contracts and gives those ventricles the ability to force the blood out to all parts of the body, or on the right side, force the blood out to the lungs so we can get rid of carbon dioxide and pick up oxygen. Now, working with the contractile cells are what are known as autorhythmic cells. Contractile cells are the muscle. They compose the vast majority of the cells of the myocardium. But the autorhythmic cells, think of those as the heart's own nervous system. If you guys ever watched years ago Indiana Jones and the Temple of Doom, Indy and Short Round were watching this shaman perform an ancient ritual, and they brought up somebody from lower part of this cave where they were doing the ceremony, and the shaman reached inside the chest of this person, pulled the guy's heart out, held it up for everybody to see, and that heart was just sitting there beating. That's actually not that far-fetched, because our heart has these autorhythmic cells. It continues to beat on its own. That's why if you're ever around a cardiac transplant unit that receives a heart to put into a recipient, as soon as they took it out of the donor, they had to put the heart on ice, cool it down so cold that it wouldn't contract on its own, because if it didn't have an oxygen supply and it didn't have a way of getting all of its nutrients, it would sit there and beat inside that carrying unit and ultimately build up lactic acid and not be useful for anybody. But the heart has these autorhythmic cells that allow it to beat on its own. Now, we have nervous intervention. We have the sympathetic and parasympathetic divisions of the nervous system that can, in fact, help to put the brakes on the heart or put the gas down if need be. But for the most part, the heart can control itself through these autorhythmic cells. And again, these autorhythmic cells compose the SA node that has the impulse go from the right atrium to the left atrium. It's also the pacemaker of the heart that ultimately sends electrical impulses to the AV node. And at the AV node, we have a short delay before we ultimately see blood from the atria get pushed into the ventricles. The ventricles are going to be innervated by the bundle of branches, which splits into the right and left bundles. And then those left and right bundle branches are going to divide into these fibers that go to all parts of the ventricles called the Purkinje Fibers. and stimulate the ventricles to contract, pushing the blood from the right ventricle out to the lungs, pushing the blood from the left ventricle out to all parts of the body. Okay? So this entire electrical activity we refer to as a cardiac cycle. And that's what ultimately gives us the waveforms that we see on an EKG. These are the waveforms of an EKG. A P wave, then the QRS complex, then a T wave. And so this electrical conduction system of the heart is what produces the cardiac cycle, which we have up here. And so, again, this electrical conduction system composed of the autorhythmic cells stimulating contractile cells to contract in an orderly and efficient manner is what allows a structure that's only the size of our fist to pump blood through miles upon miles upon miles of arteries, arterioles, arterial capillaries, venous capillaries, venules, and veins that make up our body. The autorhythmic cells, again, are going to compose the SA node. The SA node is known as the pacemaker of the heart because it is going to send out electrical impulses about 70 to 80 times under normal conditions. And those 70 to 80 impulses per minute are going to stimulate the upper chambers, the right and left atria, to push blood into the lower chambers, the ventricles. That stimulation from the SA node is going to go to the AV node. The AV node is ultimately going to send its electrical stimuli through the bundle of branches, then the right and left bundle branches, and through all of these small fibers called the Purkinje fibers. So the ventricles are going to fully contract in a rhythmic and efficient way. Think of the SA node as being the maestro that is conducting an orchestra. Okay? So this maestro is at the highest level of being a symphony conductor. Okay? It's not the understudy, it is going to be the conductor. And the SA node is going to set what we think of as the normal cardiac cycle, consisting of this P, Q, R, S, and T complex. And so this maestro, who is the absolute best conductor there is conducting this symphony. And he has to use every slight motion to tell the woodwinds when to come in and when to play at a low level, when to play at a high level. Tell the brass when to play at a low level, at a slow pace, at a higher level of volume, much faster pace, and then tells percussion, and then tells strings, and so on and so forth. And so every movement has some sort of a repercussion on the symphony as a whole. Just like the SA node is the pacemaker or the conductor of all of the electrical activity and therefore the muscular contractile activity of the heart. If for some reason the SA node can't conduct, then the understudy has to step in. Well, is the understudy of a symphony orchestra as good as the maestro? No, of course not. The understudy, well, they are okay. And if, for example, somebody has a problem and their SA node can no longer conduct the way it should, then the AV node will conduct. Okay, sort of like the understudy. But it's not as good. So things don't work quite as rhythmically. And then so when the SA node was sending out 70 to 80 impulses per minute and stimulating the heart, well, the AV node only sends out stimuli about 40 to 60 times per minute. So right off the bat, the heart doesn't work as efficiently as normal. And so the AV node's doing the best that it can, but the heart is just not working as rhythmically and as efficiently as what it would be under normal circumstances. And so therefore the person starts feeling a whole lot less like themselves. Okay, they don't have as much get up and go as what they used to have. Okay? And it's because the AV node has had to step in and do the job of pacing the heart the way the SA node would have originally done the same task. Okay? But this electrical conduction system of the heart gives us what's known as the cardiac cycle, which produces these waveforms on the QRS complex. It allows a specialist of the heart, a cardiologist, one who specializes in the heart, to make decisions about the treatment of a patient based on what they see on their EKG test. Is this person having a slow heart rate, a fast heart rate? Are there EKG changes which would indicate that the patient is actually having or had a heart attack, a myocardial infarction? Myocardial, of course, means heart muscle, and then infarction means death of tissue. So death of heart muscle tissue. That could be ascertained by the cardiac cycle on an EKG. So all of that goes together with the heart in terms of its part in the cardiorespiratory system. Okay. Now, we've given an overview of the heart, and I want to make sure that we give equal due to the lungs. And we said that the lungs were going to surround the heart, okay? And so I'm taking away one of the lungs, and if we look on this lung, we could take it apart, and we would see there are 1, 2, and then when we look at this angle, 3 lobes associated with the right lung. I'm going to take that off for just a second. And so ultimately, this right lung has 3 lobes, and these lobes, they're not just one big balloon on either side of the heart. These lobes that make up the right lung are going to be composed of millions upon millions of tiny air sacs called alveoli. Alveoli are where we ultimately see oxygen get into the bloodstream and carbon dioxide get picked up to be exhaled from the body. Each alveoli if this is an alveoli, okay, using my hand again, this is going to be a network of capillaries that surrounds the alveoli. So the alveoli is completely surrounded by arterial and venous capillaries. And what we're going to see is that deoxygenated blood filled with carbon dioxide, because it's ultimately going to come down to each of these tiny air sacs being surrounded by capillaries, deoxygenated blood is going to allow carbon dioxide to the inside of the alveoli, and then the deoxygenated blood will go through the bronchioles. The deoxygenated blood will ultimately give up carbon dioxide. That carbon dioxide will move through the bronchioles, through the right and left main bronchi, and then finally through the trachea. And then when we exhale out our mouth or out our nose, that carbon dioxide leaves our body. And so carbon dioxide gets picked up from the network of capillaries that surround each alveoli. That air sac is attached to small airways called bronchioles. Bronchioles are going to converge into larger airways, ultimately converging into the right and left bronchi, which composes each lung, the right and left lung, and the bronchi are going to lead to the trachea, and the trachea is going to carry that carbon dioxide out of the body either through the oral cavity, the mouth, or the nasal cavity, the nose. Then when we inhale, atmospheric air is going to come in through the nasal cavity or the oral cavity, go down the trachea into the right and left bronchi, converges here. We can see this is the rest of the trachea, and then it's going to divide into the right bronchi in this case, and then into much smaller airways called the bronchioles, and then ultimately those bronchioles are going to branch off into the very small air sacs that we talked about, the alveoli. So now we've taken in atmospheric air filled with oxygen, and it's going to be the job of the alveoli to get that atmospheric air and get the oxygen out of it. And so once again, those alveoli, again, they're a small air sac, and this is my alveoli. And like I said, we're going to have my fingers representing the capillaries that would surround that alveoli. Now we have atmospheric air in the alveoli. That atmospheric air contains oxygen. That oxygen is going to move out of the alveoli into the capillary network that surrounds it. Ultimately, those capillaries are going to converge into the right and left pulmonary veins, taking that oxygen-rich blood back to the left atrium. Okay, and we talked about that a minute ago when we were giving the overview of the cardiovascular system, that right and left pulmonary vein both have attachments to the inner part of the left atrium, and that allows oxygen-rich blood to now get to the left side of the heart. It goes from the left atrium through the mitral valve into the left ventricle. The left ventricle contracts. It pushes that oxygen-rich blood out through the aorta, and then the aorta branches, so all parts of the body get this highly oxygenated blood under a lot of pressure, so it gets to the areas where it's needed in a relatively short period of time. Now, a few more things that I want to talk about when I talk about the lungs. We already said that the lungs are going to surround the heart. Okay. All right. And here we have the right lung. Okay. This is the left lung. Now, if you'll notice, there's this little indentation here on the left lung that's called the cardiac notch. The cardiac notch is titled that because it surrounds the heart itself. Without that cardiac notch, the heart wouldn't have any place to sit in the thoracic cavity. And when I pull this apart here, we can see there's room inside this left lobe of the lung that allows this part to just fit right around the heart itself. And that allows that intimacy between the heart and the lungs. And again, the lungs are both going to be contained within a membrane called the pleural membrane. And the pleural membrane, much like the pericardium, is a double-sided membrane. This double-sided membrane, the part that actually comes into contact with the heart on each one of these lungs, is called the parietal pleura, but the part that's over right on the lung tissue itself, that's going to be the visceral pleura. And again, there's going to be a lubricating substance that allows these membranes to help contraction of the heart so the heart doesn't stick to the lungs, or expansion of the lungs. The pleural membrane allow that to occur so the lungs don't stick to the heart and they can expand to their fullest and ultimately make sure that carbon dioxide gets taken out of the bloodstream and oxygen gets returned to the bloodstream, so all the cells of the body get the oxygen-rich blood that they need. Okay. But those are the major structures associated with the lungs. Okay. Our respiratory structures, of course, contain the oral cavity, the mouth, the nasal cavity, okay, the nose region. They're going to combine into what we call the oropharynx and the nasopharynx. Pharynx is going to be the throat. That's the medical term for throat. Pharyngo is the medical term for throat. So we have the upper chambers, the nasal cavities attaching to the pharynx, the nasopharynx, and then the oral area that attaches to the pharynx, the oropharynx. Okay, the pharynx is then going to attach to this structure, okay, the larynx, and the larynx is going to contain the cords that we think of as producing sound that ultimately lets us make our language. This larynx is going to have our vocal folds, or vocal cords as people will call them, and that ultimately allows us to create noise and form the different words that make up our language. From the larynx, we're going to see this tube, now referred to as the trachea, and the trachea is going to branch into the right bronchus, going into the right lung, and the left bronchus going into the left lung. And then ultimately, the right and left bronchus will break down into many small structures called the bronchioles. Those bronchioles are going to ultimately form a very tiny set of airway passages that lead to the alveoli, and the alveoli are the tiny microscopic air sacs that are numbering in the millions in each lung that allow oxygen and carbon dioxide to be exchanged through a process, as we said, called gas exchange. Each alveoli is going to have a rich network of capillaries that surrounds it. Here's an alveoli. Capillaries that surround the alveoli are where the gas exchange occurs. Okay. When the alveoli is filled with atmospheric air, we need to extract the oxygen. The oxygen leaves the capillaries, leaves the alveoli, going down a concentration gradient into the capillaries. Those capillaries will converge ultimately into the left and right pulmonary veins, which are going to be attached to the left atrium, taking oxygen-rich blood to the heart. Well, those same capillaries ultimately, after oxygen leaves the alveoli and goes into the capillary blood, those same capillaries are also transporting simultaneously carbon dioxide to the alveoli, and so that network of capillaries that surrounds the alveoli is going to have carbon dioxide move out of the capillaries that surround it into the alveoli. Then that carbon dioxide will move through those small airway passages, the bronchioles, and then ultimately the bronchi, and then the right and left main stem bronchus, back up the trachea, and then finally that carbon dioxide leaves our body either through the oral cavity or the nasal cavity, and that's how we get carbon dioxide out of our body, and then we in turn inhale and just start the process all over again. Okay? But this is an overview of the cardiorespiratory system. Again, many textbooks will actually call it the cardiorespiratory system because of the intimate nature of these structures, the heart being surrounded by the lungs, but also how they have to work hand in hand for gas exchange to occur and ultimately getting rid of carbon dioxide and the pumping motion of the heart successfully transporting oxygen-rich blood and transporting waste to ultimately allow these structures to maintain the vast number of vessels in our body, ultimately giving the cells that need oxygen to perform metabolism, giving them what they need, picking up the carbon dioxide after metabolism, transporting it back to the heart to leave throughout the lungs to the atmosphere. Okay, so this is an overview of the cardiorespiratory system.